Hello everyone, and thank you for joining us. My name is Michael Fotheringham. I'm the Executive Director of AHURI, and I'm delighted to welcome you to the first ever AHURI webinar. We're pleased to be able to launch this research webinar series as a means of keeping you informed of our latest research and to help you engage with research findings from our ongoing program of research, at a time when our public face-to-face conferences and events are of course on hold. So we've brought forward our plans for a webinar program, launching a series of webinars based on the National Housing Research Program, meaning we'll be endeavouring to present a webinar for every new report we publish while current restrictions limit normal face-to-face programs. Stay tuned at the end of today's session and I'll announce the next webinar to be held in just a few weeks. And while I'm on the topic of keeping you informed, I wanted to let you know about the AHURI COVID-19 Resource Hub. AHURI's created a resource hub as a means of providing you with COVID-19 coverage that specifically relates to housing, homelessness and urban policy within our website. We want these resources to be helpful to you in doing your job, so we're endeavouring to keep across rapidly evolving policy announcements, news from around Australia and abroad, and to link with relevant resources from governments at all levels, as well as key sector organisations. The details of our resource hub are on your screen right now. And if there's something you'd like us to investigate, don't hesitate to get in touch and let us know, and we'll see what we can do. So before I introduce today's topic and speaker, I need to just provide you with a few instructions on the software and some housekeeping matters. First off, this webinar is being recorded, so if you do need to leave or you're getting distracted by homeschooling arrangements, or for that matter, you want to forward it on to a colleague afterwards, it will be lodged on the AHURI website in the coming days. At the end of today's webinar, you'll also receive a survey. We really welcome your feedback so that we can refine and improve future webinars to ensure that we're presenting information that's useful to you. Now, in terms of participating in today's webinar, here are some instructions. You're listening by default to the computer speaker system. If you prefer to switch across to using a phone, you can just select telephone and log in through that way in the audio pane. And the dial-up information will then be provided to you. You'll have the opportunity to ask questions by submitting questions through the questions panel on the screen as part of the control panel. You can submit your questions at any time during the presentation. I can see a few people have already. And we'll have someone answering technical questions as we go, and then we'll use the other questions, the content questions, for our Q&A session after the main presentation. But please disregard the raise your hand feature. We're not going to be using that function today. So now on today's topic and today's presenter. We're delighted to have with us today one of Australia's leading experts on youth homelessness. Associate Professor David MacKenzie was the lead researcher at Swinburne Uni for his AHURI report, Redesign of a Homeless Service System for Young People. The report is part of an AHURI inquiry that's also looked at homelessness service systems for families and for older Australians. This report, along with the policy evidence summary, is now available on the AHURI website, and the address is on your screen right now. David has a strong record of research and development on youth issues and youth policy, and he's widely recognised for his work on youth homelessness and disadvantage. He's the founder and current chair of Youth Development Australia Limited, and the founding director of Upstream Australia, which is a consortium of Uni SA and YDA. Upstream is focused on supporting the development of community of schools and youth services model, or early intervention, or the COS model across Australia. It's something you'll be hearing about more in this presentation this morning. So now it's my pleasure to introduce you to David MacKenzie.
Thanks very much, Michael, and hello to everyone out there, wherever you are. I'm going to talk to this project, Redesign of a Homeless Service System for Young People. As Michael said, it was part of a wider inquiry, and there are two other cognate studies of older Australians and families. And the homeless population, as we know, is made up of diverse groups. The project was aimed at identifying and proposing measures that could, if implemented systemically, reduce youth homelessness and lead to improved outcomes for young people who experience homelessness and ultimately end homelessness. So what I will do is talk firstly briefly about the research project itself. Then I'll comment on some of the findings from fieldwork and relevant evidence from research. And finally, and most importantly perhaps, I'll talk to the policy options that we think comprise a system change agenda. So if we can move to slide 3 on systems thinking, Katerina. Okay, look, This was an ambitious project, and that the giveaway of that is the implied vision of redesigning the system. But what that meant for us was, well, what do we mean by system? This is a concept that's used very loosely. We talk about computer systems, we talk about biological systems, education systems, homelessness service systems, and so on. It's just part of the vernacular of much of what we talk about. Firstly, systems are dynamic and interactional. And we sort of delved into a bit of systems thinking here to try and answer the question of what do we mean by a system? So young people should be at the center of the system. We're interacting with them and they're interacting with us in whatever way the system is conceived. The parts of a system should interact and be dynamic. And the interacting parts are interventions, programs, institutions that affect young people and that young people in turn affect. So a system centered around young people is local and community based. And where this leads us to is to think about the system, the community as a system, which is an open system, not a closed system. And of course, it's influenced by the policies and the funding and other decisions that are made outside of the community. But where it happens, where it matters, is in the community where young people live, go to school, drop out of school, become homeless, or experience other problems and live their lives out. So it really needs to be thought of as an ecosystem around the young people, and that means that it extends beyond the homelessness service system. So we'll move on to the next slide. Now we're getting right into systems thinking, and a stock and flow diagram is one way of representing the dynamics of a system. It's a useful way of representing the dynamics of the system. The stock, which is the specialist homelessness service system in Australia, is depicted in red, and you can see that on the slide. And this will be the number of young people who become homeless and for whom the local service system has the capacity to support or accommodate. The flows, of course, are the young people entering and leaving the specialist homelessness system. So the front end perspective, if you want to call it that, is whether it's possible to reduce the flow of young people becoming homeless by identifying who they are, why they become homeless, and then intervening to reduce the number becoming homeless. And the back end perspective is how to effectively and efficiently move young people who have become homeless and sought help from the specialist homelessness system into a situation where they're no longer homeless. It's a simple logic, really. And if returning home with family members is not an option, and it is not an option for many, then moving as quickly as possible into a sustainable housing situation is imperative. And the usefulness of this kind of representation is that it sensitizes to think of the system more broadly than just homelessness services. And that's an important insight. It's one of the sort of premises on which we undertook the work that we've done. So moving on to the next slide, and you're looking at this thinking, wow, this is another way to represent the dynamics of a system. And it's what's called a causal loop diagram. And what this does, it considers the causal relationships and interrelationships between various input and output variables in relation to early intervention and crisis intervention. And before you rush off and grab a textbook on systems theory, the really important point I want you to take from this diagram is simply that there are intimate interrelationships between education and homelessness that arguably have important policy implications for avoiding lifelong disadvantage, including lifelong periods of homelessness. So in simple terms, look, becoming homeless while you're at school, you stand a very high chance of not finishing year 12 and dropping out early. And if you drop out of school early before year 12, you are much more likely to experience homelessness at some point in your life. So this is an important kind of understanding that at the early stage, it's not just homelessness, it's whatever problems and issues are happening in young people's lives. And if we're going to do things earlier than a crisis, then we've actually got to deal with all of those things at the same time. Okay, let's move to the next slide. And this is how the research was done. So we really had three basic questions. Question one was, how could we rebalance our response to homelessness to do better with early intervention prior to homelessness, and how could we improve the post-homelessness, rapid rehousing and supported housing for young people. Both of these things we haven't done too well at, and they're both issues that have been around for a long time, and there's still issues. Question 2, what do we need to do to change housing agreements and policies and other policies that would redress the current issues that young people have accessing and maintaining affordable housing options? That's been an issue for a very long time, both here in Australia and I imagine elsewhere as well. And thirdly, the question we wanted to answer was, how can education and employment support systems work more closely and systemically to reduce that cohort of disadvantaged and/or homeless young people into the future and across the life course? So in terms of what we did about those questions, the system thinking meant that we thought of the system as a place-based community of interventions and programs and institutions that affect young people and are affected by them. So it's more an ecosystem, as I said before, that extends beyond the specialist homelessness service system. We also, another premise was that the most promising initiatives are most likely to be found in some form somewhere among the many programs and services across Australia. Look, in Australia, we've been pretty good at innovation. We haven't been so good at actually scaling it up and turning it into system change. And so we're not just thinking up newfangled ideas, but we're looking for things that have been tested and that could be, in fact, systemically implemented that would make a big difference. And because we're focusing on innovation and critical insight, we used purposive sampling. What this means is that we had some knowledge about where we could go, where there were community settings with promising initiatives or innovations. It's not much point in going out and randomly wandering around, randomly looking for innovations and critical insight, is it? So redesigning the homelessness service system in the way that we've approached it was about finding the reforms and measures that promise to lead to better outcomes, especially where there is an existing strong evidence base. And the system redesign initiatives and reforms are not just about changes to the specialist homelessness service system. It's about that ecosystem that's beyond it. It involves mainstream services, other service systems, other programs, and how do we put it together in a new way? So next slide. Okay, I'm going to briefly run through a few of the findings that come from research and come from the field work that we did. So we'll move on to slide 8. I just want to make a brief comment here. This is the statistical picture of youth homelessness. And the graph are those young people on their own who have sought and received help from the specialist homelessness service system in Australia. Now, you often see statistics quoted, and there's a number of different statistics. I'm not going to go into those in this presentation. But about 44% of all individuals who seek help are young people and children. But what needs to be unpacked there is that most of those are actually children, young people, or young parents in family groups. But there is this other group, a significantly sized group of 15 to 24-year-olds, about 16% of the clients of the specialist homelessness service system, who are seeking help on their own. They're fending for themselves. And that's a graph. You can't see it very well, but there's a sort of a pale blue line, vertical line, which is where we had a government white paper in about 2008, which set the goal of halving homelessness by 2020. And if I'm not wrong, we're in 2020 now. So what I would have said is that it's been a plateau. At least it hasn't been dramatically rising for the last decade or so. That's the horizontal line. But you have to wonder, in the circumstances that we're currently experiencing, whether in fact this may turn out to be an upward trend. We'll have to wait and see, because the drivers of homelessness are continuing. So let's just move on and briefly look at that. All the drivers of youth homelessness are pointing in the wrong direction. Family conflict and domestic violence hasn't decreased. More young people now are referred to care and protection services than a decade ago. Housing affordability in Australia has not improved, and youth incomes and benefits are too low, and there's issues raised constantly about rental assistance and the inadequacies of that for young people. There's also their access to housing, which is one of the questions of this inquiry. So the drivers could in fact drive up, particularly given the COVID-19 crisis that we're going through at the moment. Moving on to slide 10, young people leaving care. Everywhere we went in the communities that we did fieldwork in, pointed out that many of their clients are young people who've left the out-of-home care system, and they are a particularly vulnerable group. And the research says that reports variously that 30 to 60% do experience homelessness in the period after they leave care. It varies, but it's a high figure. They are a particularly vulnerable group. Moving on. One of the things we did in the report, and you'd have to look at the report to see some of the quantitative analysis, but we took a great interest in looking at smaller area data, community level data, to see whether the community in Geelong compared with the communities in South Australia or New South Wales, what was the, you know, when you look at statewide data or you look at national data, it's really kind of averages out all the ups and downs. In some places, the youth homelessness may be going down. It's not. In other places, it may be going up. So when we looked at the local data in South Australia in particular, about half of the young people seem to be leaving homelessness services into a further situation of homelessness. Now, that would not be necessarily sleeping rough, but it would be couch surfing or floating through some sort of insecure temporary shelter of some kind. And on the other side, this relates to the total number of clients going through the specialist homelessness services in 2018-19. More than half of them had received help previously, had been homeless previously in Australia. So those two facts are sort of broadly consistent. Moving on. Okay. Everywhere we went, this was raised as an issue. I mean, these are young people with their whole life ahead of them. Education and training, getting onto a vocational pathway, and eventually getting some sort of sustainable employment in this rapidly changing economy, particularly difficult now, with projections of very high levels of youth unemployment in the next few years, is an important factor in terms of the support that we provide and the post-homelessness support that young people need. And we haven't done very well on that, because in the past we've had homelessness services, and for quite a few years we had a job placement, employment and training program, and the two were separate siloed programs, in some places connected, but in many places not. And it was hard to see that we were making a big difference with that sort of disconnected arrangement. Next slide. Right, housing options for young people. Now, this has been an issue for decades. Young people, as I said previously, are about 16% young people on their own of homeless clients, but they only get about 2.9% of the main tenants in social housing. Young people don't get access to social housing to anywhere near the extent that you would think is justified. And we don't have youth-specific and youth-appropriate housing as a very well-developed area of housing policy. And of course, we still have a lot of issues in terms of private rental assistance and private rental housing. Young people are on very low incomes. We do have Commonwealth rental assistance. And what we heard in many places, that this is not really providing enough of the support that young people who have developmental needs, and etc. So there's problems everywhere there. And this is really the back end post-homelessness challenge. It's been around for a long time. Moving on to the next slide. Now, this is really an interesting issue. Even in the communities where there was work undertaken for early intervention and where there was a critical amount of thinking going on about the system and its inadequacies and how it might be improved, when we talk to crisis workers, we often heard, and over many years I've heard this many times, we need more crisis accommodation. We need more crisis accommodation. Do we need more crisis accommodation? And I just want to unpack this. This is an important point. This is understandable from the lived experience as workers deal with one crisis after another at the front line. and it feels intuitively right at the coalface. But is this a policy informed by system thinking that can end homelessness? So there's a couple of different levels of way of thinking about this. And on the right-hand side of the slide is a metaphor. We want to reduce the road toll, and we've been very successful in doing that in Australia. We don't really focus on installing more trauma beds. You do want trauma beds in the hospital. You want people who come in that are injured to actually be treated and survive. But what we do is we implement airbags, seat belts, speed cameras, safer cars, and improve road conditions to reduce the number of accidents. That's early intervention and prevention. And I think the point, and my colleague Tammy Hand and I have written a number of articles recently about this, is that from a systems thinking perspective, simply investing in more and more and more crisis accommodation, which we have done over many years, and we've certainly responded to crises, and in some places you do need an additional crisis facility. But that is never going to actually be able to end homelessness. We need crisis services, but we need to be doing much, much better at the front end in terms of early intervention and prevention, and much, much better at the back end in terms of helping young people into sustainable housing. Okay, the last finding, and this is not all of the findings, of course, but just the ones that I've decided to focus on for this presentation. One of the issues that the Australian Housing and Urban Research Institute wanted us to look at was Indigenous issues, Indigenous young people, and all three of the projects did that. What we found was in talking to key informants and Indigenous workers and workers in Indigenous services that work with a lot of Indigenous young people, and we know that Indigenous young people, Indigenous Australians, are overrepresented in specialist homelessness services. That's the first fact. But the two things that we were told is that what is lacking perhaps in many cases is culturally appropriate service provision and practice. And that's something that all services should be much, much better at and much more sensitive to. And the other point was that that was raised particularly by Indigenous workers, is that there needs to be choice. Young people may want to choose, often want to choose between whether they go to an Indigenous service in their community or a non-Indigenous support option. So choice is important. And I should say that the intelligence we got, the information we got, was mainly from South Australia, Victoria and New South Wales. I know from other work in Northern Australia that the issue of Indigenous services is a much bigger issue in the Northern Territory than it is perhaps in Victoria. But so let's move on to the policy options. Okay. Next slide. So I talked about back end and front end. So if you look at the left hand of the slide, improved access through youth entry points. Now, many of you won't know what a youth entry point is or what an entry point is, but it's a concept that was developed, I think, in Victoria, and it was it's now called Opening Doors, but it's about a decade old. And the idea is that people who are seeking help from homelessness services don't just rock around trying to get into services and go to another service until they can sort of find one that's able to assist them. In any community, you have one or few services that are the entry point where assessments are made and where people can be more efficiently directed to another service where they can be accommodated or supported. And while a decade ago there was some skepticism about whether this would work, it has worked. It's not a huge reform, but it does introduce an efficiency dividend. There's a couple of places in New South Wales that I'm aware where the local services have actually implemented this. And I think in South Australia, they have a sort of statewide entry point, which is not the way that I would suggest that we go. But I guess one of the reforms that would make some difference would be to implement a youth entry point system throughout all jurisdictions in Australia. there'd be an efficiency dividend if we did that. Moving to the third, oh, whoops, what have I done? Can we go back? I think I must have done something there. I want to talk very briefly about the home stretch agenda for extending state care to 21 years of age. Now, I talked before about, we do know that young people leaving care and young people who've been in care are a particularly vulnerable group. I was involved in a leaving care project in the mid-90s, and the sort of proposals and recommendations that we put out from that report are still, this is what's disturbing, are still relevant today. And I guess the agencies that work in this area have become so frustrated that they've now campaigned for this. It's a vigorous campaign. It is being picked up. It would make a big difference if we could extend state care to at least 21 years of age. Others would argue to maybe 25, 24 years of age. That would significantly stem a flow of very vulnerable young people into the homelessness service system, but we need to actually implement that agenda systemically. And the third one, which is in the middle, the green one, the place-based community of schools and services model of early intervention. We'll go to the next slide, and I want to comment on that. And I have to say that, as many or some of you will know, my fingerprints are all over this one. I have been involved in this work over the past decade or so. And the community of services and schools model, or community of schools and services model, whichever way you want to say it, is not just a particular intervention. It is actually an architecture for system change on the ground. And on the left-hand side of that slide, you can see the four key components of it. Firstly, organising a community collective of agencies and schools. That's not a program. That's a new formation that's created within a community of all those stakeholders who are going to work on this issue and any other cognate issues. And it involves identifying at-risk young people. We developed a population screening methodology that actually works, and therefore we're able to reach out to young people who are vulnerable or at risk and their families and do whatever it takes to reduce the risk that's there. And that also works. The number of crises has tended to go down in Geelong. The practice framework is crucial. In Geelong, they've created an early intervention platform. They do get funded for, I think, 8 or 10 programs. They just don't work to those programs anymore. They actually work in a much more integrated way. They still report to the KPIs for those programs and still meet those KPIs, but much more so focus on the outcomes, the social outcome of reducing homelessness and the educational outcome of reducing disengagement from school and education. And so data on outcomes, data on seeing how it's going is very, very important. The results speak for themselves. I guess what was shown when we did the evaluation of it is that the number of young people or adolescents entering the homelessness service system in Geelong over 3 years was reduced by 40%. That's hard. That's a hard outcome. And I'm not aware that that's actually been achieved anywhere else. And at the same time, in the 3 schools that the agency and the collective was working in, with no funding, by the way, at that time, the number of young people disengaging from education in those 3 very disadvantaged schools came down by 20%. That was pretty astounding. And the government in Victoria has funded the expansion of the model, and there's interest. There's an Albury project now, there's a Mount Druitt project, there's interest in a number of jurisdictions in perhaps this could become systemic. And obviously we're proposing that that should be considered in the work that we've done in this project. On the right-hand side is another way of describing what kind of model this is. Now you hear this term collective impact, and it has 5 key features. And I sometimes go around jokingly saying we invented collective impact in Geelong. We just didn't know what to call it until we read the article in the Stanford Social Innovations Review by Kanier and Kramer and thought, yeah, that's it. But it is a different approach to how you deliver services on the ground. It's also consistent with thinking of the community as a system or as an ecosystem. Okay, can we just go next slide? Back to the policy options. Okay, let's look at the back end on the right-hand side of the slide. I talked before about the problem of young people getting access to social housing. I remember talking to a senior member of a government department in Australia a number of years ago who said, we don't really want young people in social housing, do we, David? And I said, well, that's a policy that's working. There's all sorts of reasons why young people have difficulty. It's not because social housing providers don't like young people. Young people have the lowest incomes. They don't get the Commonwealth rent assistance. They have developmental support needs. And I could add that young people are more prone to engage in a noisy and intense social life than people of an older age group. They don't get access to social housing. The foundation in New South Wales of a youth-specific social housing provider, I think the first, well, certainly the first in Australia, and I believe possibly the first in the world, is with investment from the New South Wales government now housing something like, or has housed about 880 young people over the 5 years it's been there, and I think they've got about 300 properties. So there's two ways to go, either funding and expanding that sort of social housing provider, or funding mainstream social housing providers to have residences specifically for young people that are always going to be for young people, so young people actually get that access to the social housing. And maybe for them it's not social housing as a lifetime destination, but it's a kind of transitional housing that they may need for whatever number of years before they move somewhere else or get a job and their life goes on, and they may move into a private rental or may perhaps buy their own home at some stage in their life, who knows. So that's that one. Can we go? Yeah. We looked at the youth foyers. Youth foyers in Australia, their signature value is that they strongly link education, training and employment participation to a kind of supported accommodation. It's a model that's a post-homelessness model, and I've been an advocate for youth foyers. Over the past decade, I think we've now got about 15 in Australia. And in Australia, unlike France or in the UK, or perhaps on the North American continent, we've developed the youth foyers as a homelessness response. Our concern is not with the model itself. Our concern is that there is not a mandatory intake into the foyers from young people who are coming out of specialist homelessness services. Not that I would argue that they should take any and every young person who comes out, but so the strict rules around participation, education and training should stand, but a stronger link and a mandatory link there, I think, would be a significant minor reform. And if that was done, then yes, possibly more youth foyers would be a way to go. It's one model amongst others. And thirdly, the review of private rental housing subsidies. I mentioned that as an issue that came up. The Commonwealth rent assistance by itself is not enough. There needs to be other supports, and we came across a program in New South Wales, the Youth Choices program, that provided some of those supplementary enhancements, and a number of service providers in New South Wales particularly felt that additional support was making private rental a much more viable option for many of the young people that they deal with. Okay, moving on, I'm nearly done. So this is our attempt to conceptualize what the redesign challenge really involves. And on the left-hand side, I suppose you've got the current system. It's largely a crisis response. There's relatively little prevention and early intervention, despite, you know, turning off the tap a decade ago in the government white paper. And the housing and supports that young people need post-homelessness remain a significant problem, as many people in the sector will know. If you rebalance that, we need much more prevention and early intervention, and much more in terms of housing options for young people, specifically for young people. And you can see the rebalance system in the future there. We might even end up, if we do that, doing less crisis work, but doing overall much better in terms of achieving outcomes for young people, reducing youth homelessness and reducing the cycling in and out of youth homelessness. So that's conceptually how we're thinking of the change that needs to occur. And if we go to the next slide, this is a second thought. The current paradigm, if you like, of siloed, we talk about silos. We've been talking about silos for decades, siloed programs, different government departments doing whatever they do, and then you've got a coordination problem on the ground. But we deliver these programs, they're targeted programs. As someone said to me, well, you know, you get an issue, you write it up, you see how much money you've got, roll out the program and hope for the best. Youth homelessness needs both, in Victoria anyway, the Department of Health and Human Services, but also needs the Department of Education. Those two departments need to be working together in a strategic way. And the paradigm shift, I would argue, we would argue, is to a place-based approach to service delivery, if you like, a collective impact approach to service delivery. There are examples where that's being attempted. And that will, in the future, imply different ways of funding that changed service delivery paradigm. And it will require government departments at higher levels to work together in new ways. So it is a challenge, but I think we've got a number of good examples on the ground in Australia that show us that if we took those on board as systemic reforms, we could not only reduce homelessness, we're on the way to ending it. So I think I'm done. And I think we're going over to questions and answers.
Thank you, David. That was terrific. We'll see David appear on screen beside me in just a moment, I believe. Look, that was a really terrific presentation, walking through quite a complex piece of research there. And we have a number of questions, I guess, of clarifications and some comments as well. And I want to give credit to Brian Duke, who very early in your presentation bobbed up with the suggestion of looking at the Geelong project when you just started talking about the conceptual model. He picked it as Geelong project right at the very start there. I want to turn first to a question from Cole Tribe. He's asking about the collective impact approach, that education and homelessness and social vulnerability are closely linked. And to what extent are education departments and housing departments working together across the country?
Well, there's two examples where I can say that they are. In New South Wales, we have two funded pilot sites of the COS model. And what's good about that, there's been some issues in getting that all happening, but what's very good about that is the two departments have a formal MOU and are working together at that higher level to see how these pilots go, with a view hopefully to extending those pilots to systemic, further pilots or further sites, etc. In Victoria, we never had that. We had the Geelong project initiative as an innovative site where the reforms and the changes were driven by the community stakeholders. But we now have the education department heavily invested in it. At the local level, I think the departments are working together very, very well, and there's lots of collaborative work between people like myself, what I call practitioner leaders in Geelong, and very good people in both the Department of Human Services and Department of Education. What we would need, what we do hope for, sorry, I won't wave my hands around, it looks really silly, is that there'll be higher level strategic work done within government. Right up to Premier and Cabinet. I know that there is interest in moving towards place-based service delivery. There's been a number of attempts to do it that haven't been entirely successful, and it is a challenge. So I think, yes, there are some examples of where that's happening. It's not generally the case that those two departments work closely together, though.
I guess picking up on that point, a comment's just come through from Robin Huntley, that services on the ground working together is where that tends to work well. And the role of particularly, I guess, state and national governments is to try and replicate that and expand that more broadly.
I think that's a very
locally driven approaches.
That's an astute comment. Where it counts is on the ground, and you do get a lot more cooperation on the ground more broadly in lots of places than you would ever predict would happen, given the way that siloed programs are funded and what's required of both schools and agencies. So what I think we're doing with the COS model and a sort of a very deliberate approach to collective impact is formalising that by creating new institutions, a leadership group, an operational group where school workers and other workers regularly meet together on the practice issues that they're dealing with and look at the data and see how they're going. So it is a system change, and it happens first of all on the ground. It's where it really counts, and then hopefully some other changes in terms of how funding is delivered and how governments manage these new forms of service delivery. There's a challenge there.
Just on the Geelong project, there's a question from Russ Wood about how it's funded. You know, how did that come about?
Well, there's actually an interesting article in the Council of Homeless Persons April issue of Parity that's about to come out called the Geelong Project Story. And it's not about the model, it's about the story of how a local community went from where they started to where they now are. And in brief, it's something like this, that I got involved as a researcher. I had research money and I connected with the community. We then got, I think, something like $1.2 million in innovations funding. There was an innovations program of about $25 million under the previous government. And we got stage one of that, and there was a tremendous amount of work done, creative work done in terms of the real world model and the data stuff and the research, etc. And then we didn't get funded in stage two. But what normally happens when that happens is that, you know, things just go back to more or less the way they were. And that didn't happen in Geelong. None of the local leadership, or myself indeed, I was connected to it, thought to go back to the way it was. And so without any funding, using the resources that existed, the community rallied. There was a huge amount of media about it. People really came together. And that's when the difference was made. And on the basis of the outcomes that were actually achieved, I remember going in to see the Deputy Premier, James Molino, and Jenny Makakos, and we had an infographic with the outcomes, and there was a good discussion, and then I got to show the infographic. I held it up, and Minister Molino just looked forward and said, I think we're going to have to do something about this, Jenny. He got really, really excited. And in the next budget, there was $2.8 million to expand the model in Geelong. So it's now funded through education at the moment, but really it needs to be funding from both departments. You know, it's not, we don't want to sort of, oh, that's an education. It's not a school program. It's actually a community model, and it can be extended, as we're doing now or hoping to do, to deal with school leavers where homelessness is not an issue, and extended back into primary school. It's a whole of community collective impact approach to addressing disadvantage, of which homelessness is one of the key issues that we dealt with. So that's where it's up to.
Terrific. I might take you back. There's a question here from Kirsten Sandstrom about learnings from the brief piloting of the Geelong project approach in Mount Gambier, and what learnings came from that.
Yeah, that was interesting. There was some funding provided by a government department in Mount Gambier, and I got involved with the two agencies and the university there. I think we had about 15 months. There's quite a lot that was learned from that. Although there was a change of government, it wasn't continued. But one of the things that happened at the front end was you need about 6 or 9 months to actually build the partnerships, to really get the community on side, et cetera, and we were denied all of that and ended up having to go in and start working with the agencies and whatever without any of that preparation being done. So that was a difficult thing. The results that we got in that short time were actually quite promising. The schools were very open to it. It was a regional city, and I think there were some issues around, local leadership is very important. So local leadership in Geelong or in Albury makes all the difference, and we think it's a critical success factor. There was support from the agencies, but in a sense that was in Adelaide. This is not a big criticism of the agencies, but it's as much a criticism of ourselves in terms of the pilot and the choices made. The leadership interest wasn't local particularly. There were good people locally, but that was an issue. So there's quite a few things. I think we learned a lot from, sometimes you learn more from failure, although it wasn't an abject failure by any sense. It didn't continue. It had a brief life, and hopefully will rise again in terms of what might happen in the future in South Australia. And there is interest amongst the agencies in this reform approach. So I'm hopeful that in the future we'll be able to re-establish sites in South Australia. There's interest there.
Terrific, thank you. There's lots of questions coming through now, and I'm not going to try to read them all to you, but just to pick up on a theme that's coming through in several. What would you say to communities that are interested in implementing this sort of model? How should they get it rolling? And I'm going to pair that with a second question or second theme that's coming through around what would you say to government departments about, or governments more broadly, about how they can dismantle barriers to setting up this model?
Okay, they're two very, very good questions, aren't they? Firstly, we've created a network. During the time we're doing this project, we've created an upstream network, and as well as the 3 funded sites in Australia at the moment, we have about another 10 sites where communities are organising and doing all the preparation work. We call them COS site initiative groups. So it really is somewhat of a movement on the ground, a movement of people who have a positive sort of discontent and are perhaps inspired to say, could we do this in our community? So I do spend some of my time as somewhat of a roving sort of agitator, visiting communities to provide support to them. So we've set up a systemic backbone support network, Upstream Australia, which is really that consortium you referred to in the introduction, Michael. And that provides support to communities. Prior to the COVID-19 crisis, we'd visit, we'd meet with people in schools, there'd be maybe a community forum. There's planning work going on. So I'm hoping that people who hear this webinar and who are interested in perhaps exploring how they could go down this track will make contact, and we can then sort of link them into the community of practice network. We had an event last year with about 80 people from all over the place, what we call the Community of Practice Assembly. And that was really sharing our learnings. We had the benefit of our 2 Canadian colleagues who are also doing this work in Canada, Steve Gates and Melanie Redmond. So that's the answer to the first one. In terms of what can government departments do? Look, reform requires people within government and within government departments to be part of the solution. We're all part of the problem to some extent, but we spent a fair bit of time talking to key people in government in various jurisdictions. I think our thinking is that if we're going to pilot a suite of these things, that the development phase of this work is different from the standard practice of program management. It may need to be funded differently. I won't go into the detail of that, but there's, I think, a discussion to be had about that. And I think it would be a mistake to roll this out and impose it on communities and say, right, here's a program, throw in a tender, here's a bucket of money, off you go. That will not work very well. This is where you have to really do the work on the ground. It does require that you face up to the challenges of system change. It probably needs to be funded differently. So I think there's a discussion that we're starting to have I know there's a Victorian inquiry into homelessness. We're certainly going to be talking to them about it. I know there's interest with a couple of ministers about it. I know there's interest in Premier and Cabinet. There's also a discussion at an earlier stage in New South Wales. So I think we need to work together, because if this is going to happen, one, it's going to take a fair bit of time. All these profound reforms do take time, at least a decade. All the research or the literature says that. But we're going to have to engage in the right discussions, and we're going to have to stay the course in terms of seeing what I call research and development, but seeing the reform process through over that time.
Terrific. I think quite a good question come through from Anne-Marie Callender up in Brisbane. So how do place-based models like this work where place is less defined, where the young people are more mobile? There's not such a strong community as Geelong has.
Yeah, that's another interesting question.
I'm picking out the good ones.
Yeah, you're getting terrific questions coming in. I think it's true in our experience so far anyway, that regional communities do have a somewhat stronger sense of being a geographical community. I think that's obvious, and that's certainly been our experience. But the community is something that is constructed. It's not just what's there. So in the cities, you actually have to create the community of services and schools, and work out where the appropriate boundaries are going to be. As we got around the country, I did ask everybody, most of the young people that you work with, local young people or young people that are floating around, and everywhere we were told, look, they're mostly local young people. And up to a point, they are in that community. Some young people are so local that they've never been into the centre of the city. They're out in Wyndham or in the western suburbs or wherever they are, out in Dandenong. But if they become homeless, they're going to start to be much more itinerant. If they become well and truly homeless, then they're going to be floating around. So what you'd be doing there is trying to reach them and connect them with the community, whether it's the community they started out, their original community or not, doesn't really matter. And of course, we do have a world where remote communications and so on is much more prevalent. So I think these are challenges. I don't think these are particularly difficult challenges. I think we construct the communities as appropriate, and the local people on the ground will kind of have the intelligence about what that adaptation needs to be like. I won't be waltzing around like some sort of expert saying, right, this community, that community, do it this way. There is fidelity required in the model, but there's also a tremendous scope for it to be adapted to the needs of community. Communities need to own this. That's why it's the Geelong project. It's not the David MacKenzie project or the Upstream project. It's the Geelong project. It's the Albury project. Collective impact, which this model is, it needs to be deeply embedded in real communities of action, and it needs to be owned by those communities, which it currently is.
I think Marion Bennett has anticipated your last comment there. She's asking about how you see the balance between fidelity of the COS model and adaptation to local context, and how do you manage that balance, or do you?
Okay, so we've had programs. Yeah, we do manage that balance, and I think we do it reasonably well. In the past, there've been initiatives. We've done them in Victoria, where money's been thrown out to agencies and communities and say, okay, go off and do something. And often there have been programs that have kind of taken the money, done some useful things, but really not changed the system. So you can have too much adaptation. And if you do that, people take something new and kind of adapt it back to what they were doing before. That's sort of kind of what often happens. On the other end, if you have a program or an intervention and it's too overly prescriptive, then it often doesn't work as well in many communities as might be predicted, because it doesn't take account of those local conditions. So I would argue, and if I had more time, I could go into this, but in answer to Marion, hi Marion, that the community part of it is very adaptable. So it's not prescriptive. the idea of having some sort of leadership group, but two of the communities that are currently doing the model do it slightly differently. The way that you assess and measure risk, you can't just invent your own way of doing that to suit yourself. And the way we measure outcomes, you don't get to measure that to suit yourself. So there's those sort of things have to be, you have to be faithful to the science of that. But how you do it, all the practice stuff, all the interprofessional development work, exactly how you organise yourselves in terms of the collective, there's an enormous scope for adaptation there. And I think that's one of the great strengths of a model that's both requires fidelity on some things, but allows and actually fosters adaptation on other important features. And so far, so good.
So you mentioned outcomes and measuring outcomes there, and that sort of leads me to another of the questions or themes that's coming through in a number of comments and questions around how this approach sits with the increasingly prevalent outcomes-based funding approaches that we're seeing for services.
Yeah, we've had departments rolling out inverted commas outcomes-based funding sort of for quite a long time. Okay, that's a difficult question. What we do is, because this model requires the use of identifiable data and the sharing of identifiable data, which happens anyway in the human services under strict sort of things. The data management part of it locally is much more than is normally what you do for accountability to a government department. I'm not against accountability. There needs to be accountability. You know, the homelessness services provide data through homelessness systems of data collection and so on. The measurement of outcomes needs to be embedded in the work. Now, that needs to be part of the work that's done on the model. And one of the things that we provide is constantly doing the data work within the community for the community, so that the practitioners can be constantly sort of looking and thinking about how well are we going. And if we're not going so well, then we have to do something differently. So there is a different approach to data than we've currently done. It's not so much driven and managed by departments, although that will still continue for accountability reasons. This is data collected for informing practice. And I don't know whether people out there have heard of Michael Barber's deliverology, but it's really, was a pejorative term that someone invented to criticize him with, and he adopted it, and now that's what it's called. But it's really making considerable use of data to sort of check whether you're actually heading towards the destination and to sort of know where you're actually going at any one time. And I've become a sort of very much a partisan of that sort of approach, and it's built into the work. And I think it's true to say that you know, practitioners on the ground are starting to appreciate just how powerful this is. When you know how well you're doing or not doing, you're in much stronger position than you would otherwise be.
I've got a copy of the book just over here. I might turn us now to youth Foyers. We've got a number of comments and questions around the youth Foyer model more generally, expressing some concerns that it's not suitable for young people who have high or complex needs, or who are coming from particularly disadvantaged backgrounds, that there needs to be a level of stability to enter the system. Can you comment on that?
Okay, I question that. Look, if a young person comes out of a homelessness service and they're ready and willing and wanting to commit to do something in education or training, etc., then they're a candidate to go into a Foyer. The idea that Foyers should only take low needs young people, and they're a fairly expensive model for doing that, if that was the case, I think there'd be huge questions asked. You know, Foyers are generally well staffed. You know, we've got some terrific Foyers there. I don't accept that that a young person who has high needs is not a candidate for accommodation in a foyer. I think that just means you've got to work with those young people. The key condition is they've got to be prepared to commit to the education programs. That is if you're not prepared to do that, you need some other form of supported accommodation post-homelessness, okay? I know in the social housing that's provided by my foundation, most of the young people get kind of Foyer-like support from their youth support agency provider, but they don't call it a Foyer. Every young person who's disadvantaged or who becomes homeless, education and training and employment issues are absolutely crucial. And if you're not doing something about that, you're letting those young people down badly. So I would hope that Foyers do not exclude young people who have high needs or issues, but using the current criteria, which they should be providing the support those young people need. They should and they can.
I mean, I think I heard
that wasn't the case.
I think one of the challenges there is, like the COS model and like Housing First, with Foyers, there's a fidelity to the model question there, where the approach gets adapted in different ways, and there's that trade-off between locally appropriate or within the broader context of an operation. A number of comments coming through supporting your defence of Foyers. There's an invitation for people to visit one of them in Perth that I perhaps won't publicise to everybody, but some general support for that concept. The Premier's Youth Initiative in New South Wales aimed at reducing youth homelessness for young people leaving out of home care. Have you looked at that in any detail?
I'm aware of it. I haven't seen the evaluation reports on it. I know that the social housing provider, my foundations, was funded to provide pathways, accommodation pathways for some of those young people. So that would be a positive thing. I think my general view is that, and I mentioned it when I spoke to the leaving care side of things, you know, we kind of know what to do, but we're just not doing anywhere near enough of it. You know, there's not thousands of young people leaving care at 18, but for that entire cohort that does each year, we need to provide additional support so none of them actually need to become homeless. That's something that we can do. We're not, I mean, the Premier's initiative, in fact, was directed to doing some of that. I know in Victoria, the Victorian government has implemented the home stretch kind of objective for, I think, 250 young people. That's quite a significant number over a number of years. But what I guess we're saying is, well, do this systemically in every jurisdiction from now on. That's something that could be done. We could put a dollar figure on it. You know, it would make a significant difference. I'm not sure they've nailed it in New South Wales. I don't know what the evaluation of outcomes would say about that. In my view, but to my knowledge, we've not really nailed it in any jurisdiction to the extent that we could. So I'm certainly going to run off and check out what there is on that in New South Wales after this webinar.
Good to get some inspiration. I'm going to take you back to the COS model and the Geelong project. There are a few questions about, you know, what resources are available to look to replicate that. Is there a toolkit that's been created? How can people go about it?
Okay, so what we've done to date is, prior to the COVID-19 crisis, is basically we would work directly with the communities, you know, and in Albury, for example, I did a community meeting. When I actually first got up there, I suggested that they might do that, and something like 60 or 70 people turned up, including the Mayor of Albury and the Mayor of Wodonga and principals from the schools, etc., etc., etc. So at the moment, we don't do that. We're now initiating a webinar program so we can provide training. If the number of sites increase, then there will be a need for a whole lot more materials. You know, it won't work if sites have to reinvent everything for themselves. There's an enormous amount involved in doing that. So we're developing a literature, we're developing concept briefs, practice briefs. We're beginning to work with the Community of Practice Network to do some of that. So some of the people involved are working with us on that sort of work. There will be a website soon, and there'll be lots to download from that website. But essentially, we want people to join the network and to learn off each other. So I think a week or two ago, we had a teleconference with 21 people, workers from Mount Druitt and Albury and Geelong, and they were discussing the issue of, well, how do you do population screening under the current circumstances? How do you do family, youth-focused, family-centred work under the current circumstances? And I think there's an article with some of their thoughts coming up in the April issue of Parity. So there will be, in the near future, a lot out there. And since we're occasionally dropping in ads for different things here, people could contact me, and I'll certainly be there to encourage them and advise them on what to do.
And in fact, there's a couple of people asking for the web address to do so.
Well, our website's not up yet, but there is that email they can contact me with, and we'll provide materials, and we'll certainly be talking to them. There's an initiative group in Wodonga where they've got some money for their project coordinator. That work's underway. There's some terrific work going on down in the Bass Coast. There's some terrific work going on in Shepparton, and quite a number of other places, Swan Hill, and in the city as well. And it's kind of a movement that's just sort of growing. And it's interesting to reflect that this is coming from workers and agencies who are saying, look, we want to do better. Yeah. We want to do better than we're currently doing.
For those who missed it, the email address was on the previous slide. It's david.mackenzie@upstreamaustralia.org.au. Here's a plug for you. Yes,
thank you.
M-A-C-K McKenzie, yes. A couple of clarification questions on the Geelong project in particular. Did it involve both primary and secondary schools?
No, not at this stage. I mean, youth problems sort of explode in the adolescent phase of life. So that's the first thing. And sometimes people say, oh, why don't you go back to early childhood, and nip it all there? Well, I'm supportive of all sorts of things you need to do for little children in terms of overcoming disadvantage, and there's some interesting projects doing that. I take the view that we need to work backwards. That is, we need crisis services, and we've got quite a few that are excellent. We've moved back to how we might do early intervention more effectively. That's where the COS model comes in, and we've shown what that can achieve. So the next step is to extend in two directions. One is to think about how we can extend the architecture of the model back into primary school and do some useful things even before young people get to secondary school. There is a thing I hear out in schools. Look, we know the kids are going to be the ones who, have all the problems. If only that was true. There's this sort of myth that, yeah, we know who they are. Actually, what they know is that there are some kids who play up a lot in class. They're not necessarily the young people and children who have got the most terrible things happening back in their lives. They don't necessarily play up in school. And the other way we're going to extend the architecture, and there's some work going ahead to do this, and it began in Geelong, but it's going to be broader than that, is early school leavers. We know that young people who leave school early, where homelessness may not be an issue at that time, are much more likely to experience issue in the few years after they leave school, or later on in life. When you look at the clients of the Specialist Homelessness Service System, there's a huge proportion, I think it's about 6 out of 10, left school early. So we want to extend the architecture so that we follow up all school leavers who leave before year 12, make sure they're connected to an education, training or employment pathway, use technology to perhaps support them and their families, but have workers. Now, we do have in Victoria a Navigators program, which is an excellent program potentially, where these workers are funded to respond to early school leaving. And if those workers can follow up those school leavers and do it in the way that I've suggested, we're actually then extending the architecture around the same kind of outcomes, social and educational outcomes, as we've been focused on in the Geelong project within the school population.
So one of the other dimensions we talked about earlier was around out-of-home care, and there's a question here about whether fostering or boarding with local families within the school community was a feature of the Geelong project.
No, it's not a feature of the Geelong project. There've been a few examples I can think of where there's been informal care delivered to young people who are couch surfing. There is also in Victoria, I think there's a formal program where young people can be placed with families and supported there. And then of course there's the foster care, formal foster care arrangements. There's been some interest over the years in, if you know a young person is couch surfing, they're often couch surfing with the family of a friend. And is it possible to reach out to that family and say, look, there's some things going on, provide a bit of support. Would you be able to, look after this young person or continue to look after them for, a period of time while we sort out the family issues? There was a program in Queensland that attempted to do that. And I think Chris Chamberlain and I actually recommended something like that in an AHURI report years and years ago. I'm not aware that it's being done in any general sense, and it's not part of the Geelong project at this stage, certainly not a formal part of it. If it's ever occurred, it's been a sort of a particular case.
Terrific. There are, I guess, a number of comments or questions around social bonds or social benefit bonds targeting youth homelessness. Perhaps your thoughts on those?
Well, that's another interesting question. There was in Victoria a Partnerships Addressing Disadvantage for 2 projects using social impact bonds and funding, private funding coupled with government funding. And I worked with the Shepparton Consortium. We put in a very, very good submission, an excellent submission that didn't get through to the next stage. But social bonding or social bonds work when you've got very measurable outcomes, and then you can construct a kind of a model that ties funding to the achievement of outcomes and levels of outcomes and so on. I think this work, because we do have strongly measurable outcomes and the possibility of significant outcomes to be achieved, does have the potential to be rolled out in that way. And that's something I'd be very interested in exploring in the future in a number of pilots. I think from all I understand, I started out some years ago as a skeptic, and we did an AHURI project on the funding and delivery of homelessness services, and I became a little bit less skeptical. And then my involvement in the Shepparton bid, I actually learned quite a bit and realised that this had potential, and that's what I learned from that. And the fact that it hasn't happened yet, we haven't done very many of these sort of projects anyway in Australia, so it's early days. It's something we should look at, and I think it's something we should be talking to government about too.
A few comments on I guess the broader housing market, the absence of affordable supply, and whether you, looking at the tea leaves, whether you foresee any changes to the current lack of affordable supply for young people.
Well,
asking the big questions now.
I'm always an optimist. Look, I mean, the big problem, we all know, most of the people out there listening to this or watching this webinar know, and certainly people in the housing sector know, that we've had underinvestment in social housing for a long time. And and both sides of politics are to blame for this over the many years. We might not be in the position that we're in. There's a significant gap between what we need and what we've got, and we haven't got anywhere near the sort of social housing that I would think is a healthy thing to have compared to some of the, say, European countries. The reason I'm enthusiastic about my foundation, that initiative, and would like to see it either replicated or expanded throughout Australia, is that up till then, youth homeless organisations would have a sort of boutique project to create a house or a property. And for 30 years, that's how we've been doing it. And we don't have a lot to show for that kind of approach. Whereas when the New South Wales government and the sector in New South Wales came together with the view that this was the need and actually took the decision to create the My Foundation social housing provider. In 3 years, it's probably done way more than the sector's been able to achieve by those individual boutique projects in 30 years. So what we need to do is now replicate that in Victoria. I think there's been some discussions in Victoria about youth social housing. South Australia, there'll be a discussion there, maybe Queensland. We need to go to scale, and we need to really challenge governments to invest in social housing more broadly, but certainly in terms of our interest in this project in social housing for young people, which is the particular problem. I mean, the Canadians have put out an interesting report on housing first for youth, which is kind of like what I'm talking about. I'm not sure that we've yet got good examples of that in actually happening in Canada, but certainly they've done a lot of work in sort of sketching out how this would work and what the conditions and are of the sort of housing support that's needed when you provide social housing for young people. And housing first, of course, implies that young people can move fairly quickly into housing, not wait for years and years and years. So yeah, look, I mean, that's it's a challenge.
Absolutely. There are a number of questions we're not going to get time to get to today. I've tried to draw the themes from them more broadly rather than just go one by one. There is one clarification question that's worth picking up, though. Could we repeat the book title and author? I think there's two possibilities for that. They could be talking about deliverology from Michael Barker and his colleagues, or they might be talking about your excellent report, Redesign of a Homeless Service System for Young People, by David MacKenzie and others.
Well, that's eminently accessible on the AHURI website, and I think the reference to that book is in the references of that report, as I recall, if I'm not wrong.
You can get 2 for 1.
you can follow it up that way, and if you do a search on the web for deliverology, there's a number of books that have been written and how-to guides by Barber and his colleagues. I think what I think is great is that the people I work with on the ground out in the field have really adopted a sort of a data-rich approach to the work that they do, and I think that's a very positive thing. And data that informs the practice that they engage in, I think that's a very powerful thing.
There is one other question I'm going to pick up. Interested in your thoughts as to why housing options for youth are as low as it is, why only 2.9% of, I think you said, of social housing tenants are young people, and how do we improve that? A number of service providers have asked a similar question here. How do they address that more effectively? Your thoughts on that before we wrap up?
I think my general comment would be it's not because some of the social housing companies that I've had anything to do with and contact with are excellent organisations. So it's not that there's anything terribly wrong, but I think the business model that we have doesn't really seem to work for young people due to their low incomes and various other things. And so there's a sort of molecular process whereby they don't really get the access to social housing, and you've got to go through a whole process anyway to get access there. What has worked much better is to have a youth-specific social housing provider. So that's certainly one way to go, and I've talked about that. I suppose the other way to go would be to, if mainstream social housing providers were interested in having a sector of their properties reserved for young people, if they get money for that, it's got to stay reserved for young people. It's got to be quarantined as mandatory housing for young people. The problem they will have, though, which My Foundation doesn't have, is that those young people need a whole lot of extra support. And so it's really the partnerships with many of our excellent youth services and youth support organisations that really makes that model work. So you've got the housing management, but then you've got the other support. And these young people have developmental needs. Their lives are often complex, and I'm not sure the mainstream providers really want to take on the burden of creating their in-house support capacity. They would need partnerships with other organisations. So there's some of the difficulties in terms of how we make this work. That's quite apart from whether we're getting the sufficient investment in social housing for young people, or social housing generally, which despite some large billion-dollar amounts over 10 years, we still know that that's far less than we need. And we want governments of whichever persuasion to really come in and address that. And that's an ongoing matter of advocacy.
Absolutely. And some supportive comments coming through that some community housing providers have youth-specific housing, and that's an important focus as well.
That's good. Totally support that.
Absolutely. Look, that does bring us to the end of our webinar. I want to join all the people who've got in early and thanked you, David. So thank you for the work you've done and for your presentation today, and a wide-ranging discussion, lots of different questions. And before I sign off, I want to give everyone a sneak peek of the next AHURI research webinar that will be officially launching from tomorrow. So coming up in 3 weeks, the second instalment of our research webinar series will be titled Australian Home Ownership, Past Reflections, Future Directions, and will be delivered by Professor Terry Burke from Swinburne. It's a real treat. This research will examine trends in home ownership, most notably for younger households over the last 4 decades, and compares Australian trends with those of comparable overseas markets. There's some big picture analysis for the reasons for a decline in home ownership over the last 40 years. And the report also looks ahead to what can you expect over the next couple of decades, what will it look like by 2040, and some quite startling findings there. The webinar officially launches tomorrow, as I say, and will be held in the same time slot starting from 10 a.m. Eastern Standard Time on Wednesday, the 20th of May, and I really hope you can join us for that. We'd also really love to get your feedback on these. This is, as I said, the first AHURI webinar. It's an idea we've been toying with for a little while now, and we're pleased to move forward with it in the current context. But we'd really like your feedback on ways we can refine and improve the webinar offerings. And so I look forward to speaking to you again in 3 weeks' time, and once all these restrictions are lifted, to seeing you again face-to-face at AHURI conferences. Thank you, everyone.
Goodbye, everyone.